topic, I would say. And the faculty at AIIMS, I would say they are the experts in delivering their knowledge, sharing their knowledge. They have been doing it for the entire country. We are fortunate to have them around and address the Orthodontic Society. So at the onset, I again welcome you. Yes, I'm really thankful to Dr. Puneet, who has been very, very instrumental in bringing this program to CDR. I was not there, but yes, on behalf of me, he brought this program to CDR, and I look forward to host many more programs like this. And I assure you that your next 5 days would not be a waste for you. You will definitely carry some message, an important message regarding the research methodology, the basic research methodology, and we were planning to actually host a advanced course on this as well. So first it is mandatory to know the basics and then to go to the advanced. So not taking much of the time, I would just give a very, very brief introduction in what areas we would be covering this. So first, an outline, the introduction that what is a research. So a research would say, and in a long journey, how far we have come from in last 2 decades. What is the current scenario with us in terms of research? These are the questions which come to our mind. And one has to look into the literature and answer these questions. And what are the future perspectives in front of us? Whenever you plan a research, all these you have to look for. What all has been done, what is the current scenario, and are the future perspectives. So outline in any research would come, or we should know the answers to all these. Very rightly said by Rudyard Kipling that he has to answer 6 honest serving men, and their names are what, when, how, where, who, and why. So if anybody can answer all these 6 honest serving men, he would never go wrong. So before starting any research or planning, we should know what, when, how, where, who, and why. We have to look at answers to all these. So what is a research? The first question, what is a research? Finding an answer to a question which comes to our mind. So any question can come. It could be in day-to-day practice also. We say that many things we find an answer to in our daily practice. Like in the current scenario of COVID, why we are locked down, why it is necessary to maintain a social distancing or things. So many questions come to our mind. So these questions, once they come to our mind, multiple questions which need some evidence, some data to be collected, some analysis to be done, what precautions one has to take, what does the literature say, what does the epidemiology say. So why we have to do research is to answer all these questions. So a very, very important question has to arise in your mind, that what you have to answer. So finding an answer to questions which are coming to your mind, finding a truth, what is already existing in our literature, what is existing in the knowledge, what all knowledge is there in the literature, whether that knowledge was gathered in a systematic way or was that research done in a systematic way, is what we have to see what the literature tells you. If not, at least what you plan should be in a very systematic manner. So the quest from knowledge, the truth, what is seen in literature, you have to form a systematic research question, and the combination of both the experiencing and the reasoning will lead to a good scientific investigation. So it is then art of a scientific investigations. If you are answering this question, who, when, why, those 6 keys which I mentioned, you will come to a good scientific investigation. Now, why do we do research? There are 2 categories why people do research. We find in our day-to-day practice that it is a collective need, a group of people who are getting together and doing a forming a research question, or it is a need of an hour, like a scenario like this, a COVID-19. So first you have to explore new ideas and new horizons. So it is a collective effort. Many people are working on it. They have different aspects to search upon and solve a practical problems and find out that whether there are any new problems hidden between them. So it is a collective effort done by many, a group of researchers or group of people, group of faculty, group of residents. So it is a collective method. And there are few people who are into research. They get an intellectual joy by finding out some new inventions, and then it ultimately serves the society. So broadly, you can categorize in a collective effort and an individual. Individual is what, where you find that we are forced to take some research project in a form of to clear some degree, like what the postgraduate degree demands, or a PhD thesis demands, that you choose one topic that is the meeting the eligibility criteria for a degree exam, or to gain a name and fame in the fraternity, that I keep writing few projects, I keep doing some short studies for which people will know me and they will know that this work is mainly done by such and such. So it is the gain in name and fame in the fraternity could be an individual area where research is done. And of course, we are at times to enhance the CV to get better job prospects is the third criteria, which comes under individual category. Now the third, how to do a research. Research can be like you can see there is a flow chart here, that first you have to have a question. Like I said, I'm giving a very, very day-to-day example of COVID. We can correlate to our subject as well, or to dentistry. Is dentistry safe to be practiced now? So it is also a question. So many researchers are finding out that what should be done in the operatories and what. So you have to first gather what kind of virus it is, what harm does it give, and how it is transmitted. So gathering an information, first define a question, gather an information, then you form an hypothesis on which you will start working. So whatever hypothesis you form, then you test that hypothesis. Are we correct in doing this kind of a research? And for that, you need to have a data. So first you collect the data, then you analyze the data, then you interpret the data, then you publish the results, and then you retest if it is needed. So all these things will, how do you do the research? So this is the gist of the topics which will be covered in the next 5 days, and we are going to cover them in detail. So this is just to show that how one research needs to be planned. So again, a same kind of a pictorial presentation, that we should have a background to a particular problem or an issue for which we do a literature search in a scientific way, state of art of certain academic data, which we collect the data from a good source, not any data we pick up and we keep on adding. Then you form a specific research question. For that research question, how to answer that research question, you have to form a good methodology. Then you collect the data, analyze the data, discussion, write the conclusions. Why you need to know the literature? Because you have to compare with in your discussion what literature says and what are your new findings. So everything is linked up. So we cannot miss anything in between in this flow chart. This will be covering in next 5 days slowly. So what type of research are there? You can do it either a form of a descriptive versus analytical research, applied versus fundamental research, qualitative versus quantitative research, conceptual versus empirical research, implementation versus transitional research. So the last one is the transitional research. With all the basic research, what are we able to deliver to the patient, or what impact it has led to the patient care or in the society? So this is where every research should end. It has to be in the form of a transitional research. So transitional research would start from the basic research. That is what you have to understand. So from where we have come so far, if we look at the articles and the technical journals which are available worldwide, and if we say from the last 2 decades, India has actually done quite a bit here. You can see these balloon blue bubbles, which will show that this is a scientific and articles, technical journal articles, the worldwide areas which are publishing the articles. And there has been increase in the graph from 2000 to 2018. This is the India where it stands now from 2000 to 2000. So there is a great increase in the publication from the India. But where do we stand now? If we see a country-wise ranking in the scientific and technical journal articles, the India is on the 9th position. So India, although stands on the 9th position, but the citation per document and the H index is not very high. It is very low. Although the number of publications or the documents are high, but with a very less citations are less, and H index is also not very high. So this is what we have to analyze. Where do we stand now? Now, if we see country-wise ranking in dentistry, of course, we come on the 6th rank. The number of publications are high when we say we are on the 6th rank. But yes, again, a very low citation index for those articles, for those documents, and H index. So the quality of scientific publications which are going from India, the citations, the number of documentations are less cited than the publications which are not cited at all. So this discrepancy in the graph has to be reduced. If we are giving some publications, it has to have a meaning so that people cite them. So here the discrepancy lies. So we as researchers have to minimize this gap which is seen as cited and non-cited documents. Again, if I take the other branches of medicine and the areas where research has been seen, dentistry lies very low. Of course, medicine has taken a lead, but dentistry is very, very low. We are far behind than any other area where the research and the publications are being done. We are at the last in terms of sites and in terms of H index. So, dear friends, dear students, dear colleagues, we have to improve the H index and the citation index of our publication. This is what this graph is telling us. So the desire to do a good scientific study is based on that. Take this as a challenge, and please, we have to now target, or our future perspective should be to improve the position where India stands now, and that too the dental profession stands now. We have to look at the future perspectives in improving this graph. Here also a comparative graph. If we say, of course, this says that we are still, scientific output is there, index publication is not very high. We have a lot of scientific data which is published, but they are not published in the index journals. So whereas you see the United States and United Kingdoms, they are publishing in index journals. I think in the end, when we have a panel discussion, Madam would like to emphasize on this. Where we are positioned now is my emphasis. So everybody should know the basic of doing a scientific research. That is what is the question now, and in next 5 days we have to answer those questions, clarify our methodologies, ask the experts how to do a scientific study. This is what is the aim of this workshop. We do not lack in the workforce. The dental workforce is not less. We have colleges where 259 colleges are running MDS courses. And those 259 MDS courses which are running will produce around 6,228 postgraduates. So if we only look at the postgraduate thesis, we should have a good number of publication in the end. But are we encouraging our postgraduate to publish that? Is that thesis topic worth publishing? These are the questions one has to answer and see that we have to improve our position in terms of the graph where we stand today. We do not lack in the workforce. We have faculty around 34,125 who also can participate in some research. They can take extramural projects to do some research. There are different bodies who give grants to do the research. So in all, the data is not less than, or it is nearing, I would say, more than 3 lakh people, dentists we have in the community who can do some kind of research. If not all the practitioner, at least the faculty and the students should be encouraged to do a right research work. So in the end, what I would say that the way onwards is back to the basics, which is the main objective of doing this workshop for the next 5 days, imparting scientific and sound knowledge, how to a scientific project has to be, or a study has to be conducted. How do we take a PG dissertation to a higher level? And again, what I said in the beginning, a transitional research, that what impact it brings on the patient care and how we can improve our research to help the society in delivering a better treatment to them. So this is what I wanted to share with you as a background to this workshop. And now any questions? I think I have taken my half an hour. If we have any questions, you can just put it down. We will at the end, we will answer all your questions. You can put your questions around. And once the session is over, we'll try to answer all your questions. I now invite Dr. Krishna Bhatt. She would like to, she is today talking on the study design and research, which is the primary concern for all of us. And Dr. Krishna Bhatt, if I would like to introduce, she is a postgraduate from our AIMS. She is a maxillofacial surgeon. Presently, she is working as a faculty in the Department of Oral and Maxillofacial Surgery. She is very keen in research. She has done a lot of advanced courses. She has done her clinical fellow. She's a clinical fellow at the University of Polyclinic, and she has done a lot of advanced courses. You cannot match a surgeon like her in such a younger age. A very enthusiastic surgeon, a very nice person, and a very humble person. She's always there to help us whenever we get stuck. So over to you, Krishna. She has keen interest in research and she keeps helping our postgraduates in designing a study. So over to you, Krishna.
Thank you so much, Ritu Madam, and a very good afternoon to each and everyone. Just give me a moment so that I can start my presentation. I'll be talking today on study design in clinical research. I hope I'm audible to everyone. Just type in. Yeah, okay, thank you. So I would like to give an analogy. Any clinical research is like a journey. You have a scientific curiosity, and then you come out with a research question. You weave a protocol around that research question. You give it to ethics committee. Then you conduct the research, gather data, put it to analysis, and then eventually come up with a publication. But like any journey is taken to reach a destination. So what is your motto behind in conducting any research? I would say that maybe in some scenario, you want to report an unusual condition. There's a new disease in town and you want to report that. Or maybe the disease is not so new, or say for example, there is a syndrome which is already known, but in that syndromic condition, you have seen that there is something missing, there is some new feature of that syndrome, and you want to report something new. So that could be one of the reasons for any kind of a research article. Or maybe the disease is well known, but you just want to see that how many people in my village, in my country, in my town are afflicted by the disease. So you basically want to see the prevalence of the problem. You want to see the magnitude of the problem. Then again, there could be maybe you know the magnitude of the problem, but you want to investigate about the risk factors, that what are the causes because of which this disease happens, or which are the protective factors. There could be some negative factors, there could be some positive factors affecting the health. So you want to see this causal relationship, cause and effect relationship between the risk factor and the disease. And in another scenario, you know the causality, you know the problems, you know what causes the disease, but you want to investigate about the diagnosis and treatment part of it. So broadly speaking, I would say that your motto behind conducting any research would be to see the magnitude of the problem, or to see the causality of the problem, or to see the treatment and diagnostic aspect of a problem. Now, in the causality and treatment and diagnosis part, we can again subdivide the things into generation of a hypothesis, where you have some inclination, where you just have some idea that maybe it is like this. Maybe there is a cause and effect relationship between this, but you don't know yet. So there are some studies where you just see the feasibility that this could be a hypothesis, and there are some study designs which you use to test that hypothesis. So this proposal of a hypothesis and testing of a hypothesis, they are characteristic features of judging the causality and judging the effectiveness of a treatment. This is the basic motto of doing any clinical research. Now, after knowing that what we want to do in terms of research, I want you to know about two terms very specifically here. One is exposure and the other is outcome. Because all throughout these 4 days, all the different speakers will keep talking about exposure and outcome. As a clinician, when we talk about exposure, say for example, one patient got exposed to coronavirus, and as a result, they developed pneumonia. So pneumonia is an outcome, and exposure to the virus is the exposure. So for us clinicians, basically exposure and outcome, these two terms revolve around the disease. But when we talk in a research workshop, in a research background or research seminar, these two terms, they have a little bit wider connotation. For example, in a research terminology, I can also say that hydroxychloroquine or the antimalarial drug to corona is an exposure. So all the corona patients, half of them I exposed them to the hydroxychloroquine treatment, and half of them I did not expose to hydroxychloroquine treatment. And then what is the outcome? What would be the outcome there? Outcome would be to see the mortality, or see the duration of the disease, or see the severity of the disease. So in research, when we talk about research, exposure and outcome can also revolve around treatment. This is one thing I want you to know very clearly, that exposure and outcome, they don't only revolve around disease, but they also can revolve around treatment. Taking an example from the orthodontics, say for example, thumb sucking is an exposure, and outcome is a maxillary protrusion, teeth protrusion, or malocclusion. But it can also happen that you give a habit-breaking appliance. You expose some children who have the thumb sucking habit to this kind of treatment. So then your habit-breaking appliance, that becomes the exposure, and outcome becomes the success or failure of such a treatment. Once this basic things are done, then we can move on. Then to decide that which kind of study design you have to undertake, or you have to pick up. Study design is like a tool. So to satisfy any scientific curiosity, you require proper kind of a tool. For every work, obviously जो सुई का काम होगा वो तलवार से नहीं होगा, तलवार का काम होगा सुई से नहीं होगा. Similar in a similar fashion, you require specific tool to answer a specific question. So whatever may be your research curiosity, you have to see, you have to ask yourself 3 questions. That as a researcher, as a primary investigator, do I have any role in deciding the exposure status of my patients? In the orthodontic example that we just took about thumb sucking, if the thumb sucking is the exposure and if the outcome is the maxillary teeth proclination, then obviously to decide the exposure, whether the child is sucking the thumb or not, do you have any role? No, obviously you don't have any role. You are not going to every child's house and you are not influencing that child in any way so that whether he sucks the thumb or not. So in that case, it would become just an observational study. But if we take exposure as the treatment part, if you are intervening in that habit, you are giving the habit breaking appliance, and if you are judging the success of the treatment as an outcome, in that case that becomes an experimental study because you are doing something. More often than not, this kind of experimental studies, they happen when you either judge your treatment with no treatment or a placebo, or in some cases you judge your test treatment in a background of a established gold standard treatment. There is already a protocol of treatment in existence and you want to challenge that protocol. So characteristically, trials or experimental studies, they are done with a comparator group. Comparator group be no treatment, or comparator group could be a gold standard treatment. Now, as you can see on the screen, there used to be, in the old time, there used to be a set protocol for all the orthodontic surgery patients, that you have to give these patients preoperative antibiotic, and the same antibiotics they will get 5 days postoperatively. But a few researchers came up with a proposal that maybe we don't require postoperative antibiotic, only preoperative antibiotic will suffice. So what is the gold standard here? What was the earlier established thing? That postoperative antibiotic is to be given, versus what is the new proposal, that no postoperative antibiotic. So antibiotic or no antibiotic, that becomes your exposure, and outcome becomes maybe after 7 days, maybe after 1 month, you see whether the infection happened or not, whether did you have to reoperate the patient or not. So these are your outcomes. So that is about the experimental study. Now the other category, observational study, where as a researcher you don't have any say about the exposure. In that, you come to question number 2. Are you dealing with one group or there are 2 groups? For example, we were just talking about a new disease. So a new disease, you are only talking about one set of population. There is no comparator group. In that, you only want to describe that patient population, that okay, sitting in my clinic, I saw these patients, these many number of patients. Out of them, age group was this, their gender was this. So you are only describing. So in this category falls the case series, case report, and so on. Talking about descriptive study, it can also happen that there is a, say for example, for a given for a known disease, you have come up with a new orthodontic appliance, or for example, in the screen you can see that when piezoelectric surgery was new in the market, people were trying to use it in different dentoalveolar applications, and we used it for TMJ ankylosis. So what did we see in this patient? All the patients of TMJ ankylosis were treated with piezoelectric surgery. And piezoelectric surgery, we saw how much blood loss they all had, and what was the operating time, and what was the recurrence rate in this patient population. So overall, we get an idea that, okay, fine, this is a good treatment or a bad treatment, just a vague judgment. But you obviously cannot say, based on these descriptive studies, whether the good result we saw with the use of piezoelectric surgery was because of use of new technology, or it is also possible that the operating time was less or the blood loss was less because surgeon was so good. Maybe that surgeon who conducted the study, he or she also got good results with chisel and mallet. Because there is no comparator group, because there is only one group, you cannot say that this is the cause and effect. The good result is an effect of a new technology that you cannot establish based on descriptive study. However, this is a good type of study to generally see the magnitude of the problem in a community and to allocate resources. So if you conduct any kind of a prevalence study, that okay, fine, in so and so village there is increased number of oral cancer patients, so then the state government will allocate more resources to counter that problem. So this is basically used at a community level, but it does not offer treatment guidelines, and it definitely cannot be used to establish cause and effect relationship of a disease. Now coming to other type of observational study where there are two groups. So obviously you would want to do some kind of comparison. And but by comparing the data gathered in both the groups, you will apply some kind of analysis to it, statistical analysis to it. So that becomes an analytical study. More or two or more than two groups, that becomes the analytical study. In this analytical studies, you have to, again, coming back to the two basic terminologies we learned, exposure and outcome. So we have to see that at the beginning of the study, what is known from, are we going from the exposure to outcome, or we are going from outcome to exposure? Let's take an example. For example, if the direction is from exposure to outcome, say for example, in my village, I take all the village males, I take for study, male and female, I take for study, and broadly categorize them in 4 groups. One group has no smoking habit, the second group has cigarette smoking habit, the third group has cigar smoking habit, and fourth group has a pipe smoking habit. Now, out of these 4 groups, then I keep evaluating every patient. I keep evaluating at the end of 1 year, then the second year, then the 4th year, 3rd year, 4th year. Likewise, maybe 15-20 years long follow-up study. And what do I see? I see development of oral cancer, development of lung cancer. Maybe I see mortality because of any kind of cancer in the body over a period of 20 years. So here, what is known is the exposure. The risk factors is known in the beginning, and then over a period of time, I'm looking for the outcome. So we are going from exposure to outcome. Exposure to outcome is a characteristic feature of a cohort study. Now, and in this one, because I know that there is no disease at the onset, matlab, in the beginning, all the and everything, all the data collection about the outcome, I'm going to do in a prospective fashion. So this becomes a prospective cohort study. Look at the slide carefully again. So we are going from exposure to outcome, but beneath the exposure, I have written risk factor for disease or treatment. Here, the term exposure is used, as I discussed earlier, not in a clinical fashion, but in a research terminology fashion. So this exposure could be a treatment also. Example of that, mandibular fracture angle, and there are 3 types of treatment. Maybe you can use stainless steel plate, maybe you can use titanium plate, and maybe you can use bioresorbable plate. So there are treatment A, B, and C, 3 different kind of plate. And then in the future months, I will follow up these patients, and I'll see whether they develop any kind of infection or whether they develop any kind of allergic reaction to the foreign body. All the three different types of material, one is stainless steel, titanium, and bioresorbable. So I'll see whether the body, how the body reacts to it. Now you could ask me here that here this is about treatment. As a researcher, I will have some say. Isn't this a clinical trial? Well, I would say not in all cases. If I am the only surgeon, then maybe I could put this in a clinical trial fashion also, where there are 3 treatment groups. Gold standard will be titanium, and then the group A and C, the stainless steel and bioresorbable, will be put into test group. That can be done. But ours is, say for example, in my scenario, like it is in the dental center, there are 4 consultants, 12 residents. Do I have control over what treatment group the other surgeons are allocating the patients to? No, I don't have any control. It could be a surgeon specific thing. It could be their personal preference. It is also possible that patients have to buy their own plates and screws. So those who afford, they get bioresorbable. Those who don't afford, they get one of the metal plates. So not all the time the treatment allocation could be in the researcher's area. In that case, it would become a prospective study again. Prospective cohort study, because there is a analysis, there is a comparison going on. Then again, there is a concept of retrospective study. What is different? One thing is for sure, that this is exposure to outcome. The direction is set here. That is why it's a cohort study. But all the data collection is happening in the retrospect. For example, there is a hospital which does knee replacement and hip replacement. And we all know that any kind of infection anywhere in the body can travel through blood and go and settle itself into any kind of prosthetic device. So if the knee replacement or joint or hip replacement patient has a dental abscess, then that infection can go and lodge in the prosthetic joint. So maybe the orthopedic surgeons were doing joint replacement from 1997 to 2009. And in 2015, some researcher wants to see that what is the correlation between dental infection and and infection in the joint. In this case, what they did take out all the medical records from 1997 to 2009, divided all the joint replacement patients into 3 groups. One group had no dental problem. The second group had dental problem. They got dental treatment with antibiotic coverage. And the third group got dental treatment but without antibiotic coverage. So what becomes exposure here? Exposure becomes the dental infection and whether he or she was given antibiotic treatment or no antibiotic treatment alongside the dental treatment. These 3 groups become the exposure group. And what is the outcome? Outcome is infection in the joint later on over a period of time after a follow-up period from 2009 to 2015. So again, here the directionality of the study remains the same. We are checking for the exposure first. We are checking whether the patient had dental problem or not first. And then we are looking at the outcome of infection in the prosthetic joint. But all the data collection is happening in the retrospect. You are taking out data from the medical record section. So this would be your retrospective cohort study. So now we have seen prospective and retrospective cohort. What is easily evident is that long follow-up period is required to draw any meaningful conclusion. So it is obviously not useful for where you want quick answers. That is number 1. And number 2, it's not useful for rare diseases either. For example, if I want to see what is the correlation between a pregnant mother taking some kind of medication and her baby developing developmental, say, facial cleft or craniosynostosis defect. Now, facial cleft and craniosynostosis, they themselves are such rare problems. Imagine how many pregnant women you will have to take up in order to follow them up prospectively and come up with any conclusion. So it is not useful for rare, and it is not useful in scenario where you want quick answers. Now, another scenario, same analytical study, observational analytical study, where in this scenario, the directionality of your study is different. At the outset of study, you don't know about the exposure, but you know about the outcome. So basically, you know whether there is disease or no disease. That is the characteristic feature of a case control study. You, at the beginning only, you know whether there are two groups. One group has the disease, the other group does not have the disease. And then you check both the groups for their exposure to the risk factors or beneficiary factors. For example, there is a village and a researcher goes there and conducts a study, divides the population in broadly two categories. One has the oral cancer and the other group does not have the oral cancer. And then, so this is the outcome. Disease or no disease is the outcome. And then you are going to evaluate their habits. Habits could be positive habits or negative habits. It could be, say, for example, twice daily brushing is a positive habit, and tobacco chewing or alcohol consumption is a negative habit. So you are evaluating all the exposures. Exposure doesn't have to be only negative all the time. It can be some positive, good influence. It could be an exposure which has the good influence on human body. So this is, but the directionality is very clear here that we are going from disease or the outcome to exposure. What is the use of this study? This study is very good to evaluate rare disease because you already have two categories. Rare disease, okay, fine, craniosynostosis, I'll go to neurosurgery department, I'll get craniosynostosis cases, that will be my disease population. And then I'll go to some other department and get the non-disease population. So you get your patient population very quickly in, even for rare diseases, in a case control type of a study. Another very useful thing is, whenever you want to, for infectious diseases, you want to check disease outbreaks, small disease outbreaks. I'll give you an example. Say, for example, there is a Mohalla clinic in Delhi, and suddenly that doctor tells the authorities that normally I don't see this many typhoid patients, but in last 1 month I'm seeing so many typhoid patients. Then the investigators will pitch in. They will come and what will they do? They will recall all the patients who visited that Mohalla clinic in last 2 months. They will divide into two groups. One is typhoid patients and the other is other patients. Maybe they had common cold, maybe they had malaria, but maybe they had vomiting, not vomiting because that would vomiting, diarrhea, any abdominal complaint will again go with the, they will again go with. I'm getting the question from Stuti Raj, but I think we can wait for all the questions after the presentation. So please. Okay, so coming back to our Mohalla clinic example. So what the researchers will do, they will recall all the patients from last 2 months, broadly divided into typhoid and non-typhoid categories. Non-typhoid could be anything else. They could be anemia patients, they could be common cold patients, but not those patients who have any kind of complaints which coincide with complaints of typhoid. And then they will take history. So this is outcome. Outcome, you know, typhoid and no typhoid, disease and no disease, outcome, you know. And then you go to, then you try to investigate at the exposure. You ask all of them, where did you eat? Did you eat outside your house in last few weeks or not? Then you will ask, where do you stay? Then you will see from where their water supply comes in. Maybe it's possible that the cluster of typhoid patients, they were eating out at one particular eatery, and that one particular eatery did not have good hygiene standards. That's why the disease origin point is one only, and that's how the disease spreads. So it is good to pick up the disease origin in an infectious disease outbreak. Or maybe they all were staying in one particular area, and that particular area, the water pipeline, the drinking water pipe and the sewer pipeline, they were getting mixed up. Something like this. So you can come up with a source of a disease in case of an infectious disease outbreak scenario with the use of a case control study. However, there is a catch here. Maybe those typhoid patients do not remember whether they ate outside or not. So these studies, they are typically susceptible to recall bias. Many of the cases or many of the diseased patients will not remember whether they had any exposure to risk factor or not. So this is number one. Number two is definition of cases and control need to be very specific. cases, of course, you know that these patients, this cluster has a typhoid, but those patients whom you have taken as controls, maybe they had only common cold symptoms, maybe their body was not showing symptoms to typhoid, but they had typhoid. So there could be some overlap between cases and controls, and in designing protocol, you have to be very, very sure that there is clear-cut boundary between cases and controls. So this is about directionality from outcome to exposure. Now there's a third type of a story where you are evaluating exposure and outcome at the same time. So there is no directionality, no forward, no backward, no exposure to outcome or outcome to exposure. Everything is happening together. So this is like a snapshot in a timeline. We are not following up anything prospectively or retrospectively, but it is done at a given point of time. What's the example? Example is prevalence studies. For example, you saw all the people of that village, just gathered two things, just gathered two basic parameters. Did they have oral tumor or not, and did they use chewing tobacco or not? So what will be your categories? Your categories will be 4 types of categories. What is the outcome? Let us see for that first. Disease or oral tumor is the outcome. What is the exposure? Exposure is the chewing tobacco. So there would be 4 categories. People who did chew tobacco but who did not have tumor, and those who did have tumor in the chewing tobacco group, and then there will be another group which had no habit but still had tumor, and there would be some people healthy in that group also. So there will be basically 4 categories. When these kind of studies are used, basically they are used when you want quick answers. They are very economic to conduct, good from public health point of view, and it will give you some kind of correlation that, okay, fine, in people who chew tobacco, I see more tumors. But can you say that it is because of the chewing tobacco that they are having oral tumors? No, because there could be other risk factors. There could be now this chewing tobacco and oral cancer is an established fact. But when we are testing this when we are doing research to investigate any new kind of a disease, that time we don't know cause and effect relationship. Maybe it's possible that the patient is having tumor, that's why he or she is so depressed, that's why he or she is indulging into some kind of bad habits. So you cannot establish cause and effect relationship based on a cross-sectional study. You can only say about correlation, that these 2 things happen together, but what causes what, that we don't know. So what have we seen up till now? We have seen that there is a set of studies like case series and case report, which are only descriptive, which only state things as they are, which do not give any cause and effect relationship. Then there is a set of studies which are observational, analytical, where there are 2 or more than 2 groups, and then you are trying to see some kind of causal relationship. So part of this would be case control study and cohort studies. And then there is a third type of a scenario where the investigator has an option of intervening and definitely checking that cause and effect relationship between the treatment and outcome. So there is experimental type of studies, and as we can see, it's like a pyramid. As you go from descriptive to analytical and analytical to experimental, you're establishing of cause and effect relationship or establishing or testing a hypothesis, it becomes stronger and stronger. So the lower you are in the pyramid or more towards the descriptive side, less the evidence level of a study. Having said that, you should not always be after high level of evidence, because what is important is to generate a research question, to ask right questions. If you ask right questions, you will get right answers. For a new study, for example, imagine when this corona story was very new, that time when nobody knew about the disease, can you come up with any experiment? No, you basically first need case series, case reports. Anything new, you first want to describe it. What is the natural progression of the thing? Then you come up with a hypothesis, and then comes the testing of the hypothesis. So all the study designs, they are important. What is important is right application for the right research question. So remember that you have to choose your tool wisely. Ask right questions to get right answers. With this, I conclude my talk, and house is open for discussion if anyone has any question. Thank you very much. Any questions? Okay, there is a question. Can we elaborate on PICO? Okay. So PICO is patient intervention, control, and outcome. So again, patient population, you have to decide. Intervention, that is the risk factor or exposure to treatment. And then the control, what you are comparing it with. Maybe you are comparing it with placebo, or maybe you are comparing it with the gold standard. That will become control. And then O stands for outcome. So you have to define what you are going to see. Are you going to see the success of the treatment, or you are going to see the complications of a treatment? So these four, yeah, PICO is a very important this thing, but I am sure that will be covered later on in the workshop. So that's why I didn't touch it. But there is a fifth factor also, PICO, and then sometimes timeline is also added. So sometimes it is not only PICO, it is PICOT. Timeline is also added. So that's there. Anything? I hope that's clear. Hello? Hello?
Yes, madam, there's one more question.
Yeah.
From Sukanta Seal. It says, I think before that there is an Anjana Rajgopal who was asked, ma'am, what would be the advantage of retrospective cohort study over case control study?
Retrospective cohort over?
Advantages of retrospective cohort study over case control study.
So as I said, retrospective cohort is after all a cohort study. It will help you establish cause and effect relationship better. And case control studies, they are typically reserved for rare diseases, or where in one you know the exposure, and in the other you know the outcome. So in cases where there is rare disease, so rare outcome, so you want to have a case control study there. But in retrospective cohort, the directionality is from exposure to outcome. So you see whether the patient was exposed to a particular risk factor or not, and then you are checking for the development of the disease. I hope that's clear. It's all a game of directionality. Are you going from exposure to outcome, or you are going from outcome to exposure? If it is exposure to outcome, then it's a cohort study. If you are going from outcome to exposure, it's a case control study.
Another question from Sukanta. Retrospective cohort study can be used for rare diseases is the question.
Bad idea. Again, because in cohort study, you will go from exposure to outcome. And in going from exposure to outcome, if your disease is so rare that your outcome is very hardly to come by, how are you going to check that? Rare disease case control study, because in that you will have to have basically, if it's a rare disease, there will be two options: patient who have disease and patients who don't have disease. The patient who have disease, to gather those rare kind of disease, you want to have first first set of people in whom the outcome is known. So then it automatically becomes a case control study.
Yes, madam. One more question from Dinesh Kumar Puga. The difference between confounder and intervening variables.
Confounder and?
Intervening variables.
I think that's the topic for tomorrow's talk. So let's not confuse everyone by talking it just now.
Okay. I think with this we conclude the questions. I think there's no more questions.
Okay, thank you.
Thank you. Over to Ritu, madam.
Thank you so much. At this moment, I would like to thank Dr. Krishna. Am I audible? Thank you so much. At this moment, I would like to thank
you, Prabhat,
Krishna for taking a very informative lecture on study design in the research. Thank you so much, Dr. Krishna. And if we are having any more question, we can type, and at the end or during the discussion, we will address all the questions. Our next speaker is Dr. Sumit Malhotra, sir. And Dr. Sumit Malhotra, sir, will speak on formulation of research question and hypothesis. And Dr. Sumit Malhotra, sir, is the additional professor in the department in the Center for the Community Medicine, and he is currently pursuing the Commonwealth Scholarship Master course in clinical trial from the London School of Hygiene and Tropical Medicine. I don't want to waste any time in introducing sir, because the introduction of sir would be his lecture only, and he in this area is the excellent one, I can say. So please welcome Dr. Sumit Malhotra, sir.
Okay, thanks for the kind introduction. Am I audible to all?
Yes, please.
Okay. So, taking over from what has been covered so far, one of the very important fundamental thing that one needs to know before embarking on a research journey is that what is the answer that you're trying to find out for, and the key to know this is what's your research question, and if that research question has an implied hypothesis, what that hypothesis be. So the next hour we'll focus our attention as what takes us to defining our research question, how do we formulate a hypothesis, and then we will also talk about a little how the research question is linked to the study designs, as just being elaborated previously by Dr. Krishna. I'll also shed some light as how they are linked in this. We have learned so far that research is a systematic journey, basically, which is intended to establish facts. We want to add to the scientific knowledge by reaching on to the new conclusions. Always remember that whenever we do research, research is an investment. It requires a lot of resources. So it's important to think that whatsoever any researcher is aiming to carry out in the research journey should contribute to the scientific knowledge, should expand our thinking horizons, and also should contribute to changing our practices for the betterment of humankind in terms of the outcomes, the healthy outcomes that we are looking at. Professor Ritu Madam also talked about the types of research. There are 3-4 things I would like to mention over here. Is that because the kind of research that you are going to take also is going to make you think about what kind of research questions can be discussed about when you're talking about the research. So we have epidemiological research, which deals largely with distribution of diseases and their determinants. We want to find out the magnitude, the burden, and this largely is basically, the questions are, what's the prevalence of the disease, what's the incidence, how much is the mortality. So right now in the scenario of the COVID-19, I mean, we all are concerned how many new cases are occurring. Every day we are basically getting a report from the government. There are media bulletins that are being released by states. How much is the prevalence? Well, in COVID, we are doing now serological testing, which is going to tell you about the prevalence. So what's the geographic spread? Why this is occurring and what are the factors. So this all is about epidemiological research, which talks about the burden of disease. And this is basically going to help us to know, how much action is to be taken up. We have a laboratory science research or the basic science research, which deals with the, lab related work, which could be related to genetics, biotechnology, the animal studies. All of this is going to advance our knowledge pertaining to the pathogenesis related to the disease. Some diagnostics also pertaining to particular disease. Then we have the clinical research, very important, wherein we are concerned about, what all interventions we should have in order to solve the diseases related to all the systems. So this could be the drugs, so the vaccines. So right now we are concerned about, when is this COVID coronavirus vaccine going to come, and there are many questions as how to have this vaccine. What are going to be the delivery strategies for these, pharmaceutical interventions. There are also, apart from therapeutic interventions, we have preventive interventions. So whole lot intervention research is basically the subject of clinical research. Another area that I want to basically mention at this juncture is about that we have an increasing interest by researchers now in the area of operational and implementation research, and this is particularly very important, for people who are there in, say, public health dentistry or the background that I have, wherein there's a lot of actionable elements which can be researched as what makes the delivery of a program component better. But how do we take the interventions, related to the oral health program, reach the right subjects, and also in the right form of delivery, the way we envisage. Say basically how the grassroots workers are taking up oral health services, the last person, the last mile, sitting somewhere, in the remotest part of our country. How school platforms have to be utilized for delivery of services, and what best way can we implement, program interventions in the schools, and similarly in the clinic settings at large. We also have a translational research, and Professor Ritu Madam talked about, that we there's an increasing importance which is given to the translational research, is basically reaching out the interventions more to the society rather than just to the closed offices or to the research centers. Now, when we take an initial journey within the research area, that we need to define research question. Research question is linked very closely to the hypothesis, and if hypothesis is going to be there in the study, it has to be developed on basis of the question that you have. And then finally, we come up with aims and objectives, and these are the preliminary background, work which one needs to undertake before actually venturing into the methods for answering your research question. So what is a research question? Research question is a clear, focused, concise, but sometimes complex and arguable question around which the entire research process is centered. Now, this has to be clear, and it's very important to understand that the clarity has to be there in the minds of the researcher who is undertaking that research project, because unless and until the researcher is going to be clear about what research question I'm trying to find an answer for, at the end also, till you get an answer, you won't be clear as what answers you were looking for and what have you answered. So it basically helps us in clarifying, the scope of the research, and also it will help us in bringing focus to the research idea as what at the end, we aim to achieve and what we are going to answer. The importance of the question, I think it's a paramount. It has a paramount importance. Unless and until the research question is clear, the entire research path, the research journey a researcher takes, it could be a fruitless journey if you don't know what the research question was. And often, many a times, if you are a postgraduate and if you are presenting your thesis, or any researcher if takes ask for funding, many of the the panelists who are reviewing the protocols or who are reviewing the proposals are going to essentially debate on what's your research question, and that decides a lot the merit of the proposal. So when you talk about, what a research proposal component, I mean, what is going to be a key component in judging your research proposal, I think it's the research question. Now, this is the starting point of any study. Everything flows from the research question. So this is the crux of the entire research project, research journey. The methods, the study designs, everything flows from the research question. So research question is the key thing, which requires a lot of investment and time, and often it takes a considerable amount of time to figure out and to pen down a good research question. So you will have to do a lot of hard work in reaching to that particular stage, because then ultimately everything flows from there. Now, this is going to determine, as I said, the methods. And when I say the methods, I basically imply, what is the population which is going to be studied? What is the setting? What is the data that is going to be collected? And what is the time period? So all of that basically comprises the methods, and the initial research protocol details about that. Now, a good research question is really the first step of the research process. So there is a lot behind that goes before you really reach to a destination of a good research question. And it requires, a mastery. It requires a lot of reading. It requires a lot of reviewing the existing literature. Systematic reviews and meta-analysis these days are available in plenty. But of course, you will have to lay hands on good ones, which have critiqued the literature, the existing body of evidence, and know the worth and merit and demerits of what's already being known. Now, by reading or laying hands on these systematic reviews and meta-analysis, now meta-analysis, for those people who do not know, is basically a kind of systematic review. But at the end, what we do is we pull up results systematically, quantitatively, and find out the summary measures as what the evidence is. Largely, it is done in an intervention research, but also now we have a meta-analysis for prevalence studies or for risk factors and pooled up evidence, because sometimes individual studies, they lack sample size. When we combine evidence coming from many of the available literature, it basically gives us the weighted pooled estimate, which basically is a better level of evidence. As Dr. Krishna was saying in one of the slides, she was highlighting about the evidence pyramid. Meta-analysis, systematic reviews actually are the highest level of evidence. Below that is the randomized control trials. Now, by laying hands and by reading the literature reviews and meta-analysis, one basically aims to find out what are the gaps in the knowledge, why these gaps are existing. Now, how these gaps can be bridged. Now, what we need to understand is that what is already known is known, but what is the quality of evidence? And what is not known, I think that is what is worth answering and basically, embarking upon. So it will require a critical reading of the scientific literature. Well, all of us have now access to search engines to lay hands on these search engines, whether it's PubMed, whether it's, there are Indian search engines, or it's a Cochrane library, or any other source, wherein you can find, these available literature. You should basically read it. So it's important to understand that you have to have a critical reading of the available literature. Now, many questions also stem from your clinical experience or your field experience. While day-to-day practice, when you are dealing with patients, and when you're trying to help them, there are many things that you are not having answers for. So they basically give you a hint at what these questions could be, and they require, further investment. Many of the times, we are there along with our teams in ward rounds, with our teachers, with our mentors, who keep discussing. Journal clubs are good, important source where a lot of knowledge gets exchanged. There are a lot of ideas that are being generated. So you generate a lot of your ideas based leads, your peer teachers, and you basically also observe many of these things while dealing with patients, and they will all help you in generating questions and the ideas. Now, it's important to understand that just because you don't know the answer, it doesn't mean the answer is not already known. So this basically leads to say that you have to do critical review of the literature. If there is a lot which is there in the review, limit your search for the last 2 years. It's important to understand that these reviews will always conclude by saying what is not known, what future researchers should focus on, or they will also give hints to what the existing the gaps in the existing knowledge, in terms that sometimes we have the evidence, but that evidence lacks rigor, or basically is low in the evidence pyramid. So sometimes the methods are weak, sometimes the patients are less, so our confidence is basically less on the evidence that we have. So I think it's important to work upon those methodological flaws, which basically can be guided by the existing literature which is there. Now, if there are no systematic reviews, there are no meta-analysis, this itself basically is the first thing that you should do. And you can embark on, undertaking a systematic review and consider writing it, updating one. Believe me, it's a lot of work, but then you will be contributing a lot to the scientific community. And of course, remember that any review article, gets a lot of citations, because most of the people start their introduction with quoting and citing to these systematic reviews. Now let's see this. So what's important in the initial aspect is that you find a research topic. So basically, what is the topic of your interest? So compare this with an onion. Is like, I'm interested in one particular area, say these days now COVID-19, and if suppose you're a dental researcher, so you are basically interested in one topic related to COVID-19 in the area of your work, but then that's a very big thing, peels the onion. So what exactly is going to be the research question is one layer, is something that you have to come up. So what's the take home message from this slide? The take home message is that the topic of interest is first thing that you have to really narrow down, to say that what your research question is, and to reach to that particular stage from topic to the inner research question, you will have to do a lot of reading. Now, so research question has to be more focused. It builds on what is already known. It is going to fill a gap, and it's going to advance the science one layer at a time. So it would be just one brick in a larger wall, and it's sufficient because each research question is going to have a considerable amount of investment of time. So if you contribute to the knowledge, it may be small, but it would be worth an effort. Now, so what are the steps? So you need to understand, you find a topical area of interest. What's your clinical work? Maybe you are in a particular stream of dentistry and you are focusing in a postgraduate research. So that stream is the topic of interest. Within that also, there are many areas and you basically focus. You have to explore the issue in depth. Of course, the topic has to be interesting, and because you are going to spend considerable amount of time, it has to interest you. Because, I mean, what is known, what is not known. If what is not known, I mean, why somebody couldn't do that part of research. So you will also, and then you will have to think about, if something is not known, if I try to find out the answer for, how is that going to change my practice? Are people going to be interested in knowing the answer for that? So all of this is going to help you out in refining and focusing your attention. Now, this is important to understand that if you are aiming to answer a particular question, you need to also think about, I mean, who is going to care if an answer is going to be found? So are other people also enthusiastic in finding an answer for the question that I'm trying to invest upon? So this is going to lay some light on the importance of answering the question. Is the question a new spin on old ideas, or the same old spin on the same old idea? And how answering a particular question is going to change the practice? Ultimately, all of these questions are going to tell you how worthful finding an answer is. And if it's already known, people will not be interested, to be contributed by your research. If anything, I mean, right now, everywhere the COVID-19 research, in all the settings in the world, people are interested. I mean, there are a whole lot of research proposals, the intent, the call for expression, and even at AIMS, I mean, there's a lot of interest. There are COVID interest groups. I mean, there are national task forces, and we have a lot of research questions, as also being highlighted by previous speakers. Now, somebody was asking, a research question should answer the elements that are there in PICOT. So what PICOT stands for, so P is the population. So which is the age group? What is the population that you are interested to answer question for? So is it the childhood years? Is it the adulthood years? Is it the elderly? Are these people from rural areas? Are these people from urban areas? Is it a community-based setting? Is it a clinic-based setting? So all that is going to comprise population. Now, in a typical interventional research, we have and in an analytic study wherein we are going to have the comparators. There we have the the intervention and the comparison. And as I elaborated, there are a variety of interventions in the clinical research. Some are therapeutic interventions, which could be drugs, which could be vaccines. Sometimes, the scope of research is looking on how to deliver the intervention, maybe some are preventive interventions. So, for example, the educational interventions, maybe a mobile-based educational intervention. Now, these days we have digital platforms quite active. So, and they all are mediums of literacy. So maybe an internet-based, mobile-based, there are a variety of interventions that are coming. So we have the drugs, we have now the social distancing. Well, that itself is an intervention. And then there are a variety of other interventions which are talked about, and people really do not know, what these interventions are going to work for. So all of these are interventions, and largely in randomized controlled trials, this intervention versus a comparator is going to be elaborated on. So a PICOT should elaborate on if there are two groups. In one group, the intervention group, what your subjects are going to be exposed to. And if you have a comparator group, what that comparator group is going to be exposed to. Now, we are looking for the effects now, as also being highlighted by Dr. Krishna, that we have an exposure and outcome relationship that we are interested to determine. So our O stands for outcome, and there are a variety of outcomes. There can be clinical outcomes, there can be lab-based outcomes. There are outcomes which talk about quality of life. So there are a variety of outcomes which can be there. One outcome could be just death. Like in these settings of COVID-19, if you are exposing people to interventions, and one of these things we want to understand that how many people die, how many people are discharged healthy. And of course, in the intervention setting, we can't have interventions exposures, infinite time. So we want to study the outcomes. So you need to mention at what time point you're going to study your outcomes, which also leads us to think about what is going to be the time period for exposure of intervention. A very, very important framework which all the researchers should think about. This is a very essential element, particularly for intervention research, wherein even if you're going to aim for reporting or publication of any randomized controlled trial, or it could be a non-randomized clinical trial, researchers will be asked what your PICOT is and what you are trying to find answers for. Now, I'll illustrate this by some example. Now, in the setting of COVID-19, as we all are interested, and it's happening with all of us around everybody is now worried about COVID-19. There's a lot of research. So I thought I'll take one example from the COVID-19 area. So there are a lot of these Ayurveda products now which are being promoted, say Chawanprash or say Amla, which are going to boost immunity. So if somebody takes, say elderly, if I'm interested in elderly, because elderly are the most vulnerable groups right now, which are going to land up in bad outcomes. So whether these Ayurveda products intake for 3 months, as compared to the usual diet, protect against COVID-19 in older population above 60 years of age. So this is my research question. Now let me see and illustrate what the PICOT could be. So I'm interested in population which is elderly. I'm interested in looking, as an intervention, people being exposed to the Ayurveda products. I'm interested in comparing, people who are just consuming their usual household diet and that's not having any Ayurveda product exposure. I'm looking for the outcome, whether they get the coronavirus disease, and the time of exposure is 3 months, and I want to see whether they had free of disease, or they already have protective antibodies, and what their response is. So this is one question. So try to find a question which can have the elements of PICOT. Now sometimes we don't have an intervention research, but we have the observational studies, but essentially analytic studies. So the PICOT, the take-home message is that any study that has got a comparison group, I mean, wherein you have two groups, one group of patients or people exposed to something, the other group is not exposed to, and then you are looking for outcomes. There, the PICOT is basically very, very important. Now, say, for example, another question is that young people, so I'm interested in young people here. So young people less than 25 years, and if somebody was consuming, I mean, the youth group, substance use was there, is that linked to suicide? And that's my question. And I'm interested to know that whether they have increased suicidal attempts tendency. So I want to basically answer this particular question. My outcome is suicidal attempts. And say, for example, 2 years, and this is a longitudinal study which is looking at. So it will have, young people who are exposed to a habit of consuming substance, the other group of youth not taking any substance, and I'm looking at the suicide at the end of 2 years. So this is how I generally have the PICOT framework, which can be there in the analytic studies, whether it is observational, maybe case control and cohort, or it could also be RCTs or non-RCTs in experimental studies. So after looking the PICOT framework, we have another criteria, and it's called as finer criteria. So if I have a research question, the another filter test one I needs to the research question should pass at is basically finer criteria. Now finer stands for, F stands for feasible. So is the research question feasible? Now any research journey will require resources in terms of time, money. So is this feasible? If sometimes the sample of subjects that you're going to require are going to be too huge, and if one cannot have the available resources to recruit those many subjects, maybe if it's a rare disease and you don't get so many subjects, or your clinic doesn't cater to so many subjects, of course it won't be feasible. I did deliberate upon the question that you're trying to answer should be interesting. Of course, everything that is novel, new, basically sells more. I mean, the business is more for any new item. Like, for example, I mean, people are interested right now for funding for work related to vaccines related to coronavirus. Is something new. So anything related to coronavirus in this setting is going to be novel. It's going to answer to our questions we all are struggling with. Of course, in these days, no research can be done without considering the ethical aspects. All research has to be ethical. There's no harm that you have to do. So your research has to be ethical, and the question also has to be ethical. And of course, it has to be relevant, it has to be worthful, it has to have the potential of changing the practice. So after that, you have a research question. Let's now also understand a bit about hypothesis. Now, when we talk about hypothesis is a carefully constructed statement about a phenomenon in the population. Not all questions will have hypothesis, but then many questions will have hypothesis. So it is basically a statement about an expected relationship between two or more variables that permits empirical testing. Now, most of the analytical studies wherein we can have exposure and outcome, wherein we can have a Picot framework, will have a hypothesis in mind. Now, there are varieties of exposures and outcomes, and you all, I think this was highlighted in the previous presentation also. The exposures can be, variety in your orthodontic setting. Similarly, the outcomes can also be a variety of these. Like, for example, you have socioeconomic status, can affect the oral hygiene status. The fluoride levels in the water can affect the dental caries. So, variety of the orthodontic treatment affecting, various variety of outcomes. So there are variety of these exposure and outcomes. You need to find, within your research area and the research question, what your exposure and what your outcome is. You are essentially looking at relationship between this exposure and outcome. Now, many people call the exposure variable by different names. So these are just the synonyms that are being listed on this particular slide. Like exposure, sometimes people call this as a treatment, a risk factor, explanatory variable. The statistics people call this as predictor variables, independent variables. The outcomes also have many synonyms. So some people call this as endpoints or disease or condition, response variable, dependent variable. So outcome variable is dependent. The exposure variable is referred as an independent variable, and these are called as y-variable. And largely the mathematical equation and statistical people are very fond of using this predictor variables, independent variable, dependent variable, x variable, y variable. So there are many names, but essentially I think the take-home message is you should know what your exposure variable is, what your outcome variable is. So in a hypothesis, we are looking for a relationship. And mind you, hypothesis is an assumption. Now, the assumption is that there is a relationship between the independent variables and the dependent variables, or the predictor variables are going to influence the outcome variables. So exposure, the outcome is conditioned to an exposure. And essentially, we are going to be interested at the end of the study, is there any cause and effect relationship? That means the effect in the outcome, can it be attributed to the exposures or differences in the exposures? Now, the hypothesis has to state the level of relationship and the kind of relationship that exposure and the outcome variable are going to have. So when testing of hypothesis is being done, we would like to identify what are the likely causes of the disease, what are the changes in the condition being observed. And as I stated earlier, analytical studies will have essentially a hypothesis. So research question basically tries to generate a hypothesis. Not all studies are hypothesis testing. There are some which are hypothesis generating. Your descriptive studies, case series, case reports, these are basically hypothesis generating studies. Similarly, ecological studies, cross-sectional studies are like, some have analytic component also, but largely they are hypothesis generating studies. So hypothesis testing studies, the case control, cohort, RCTs, they're all basically hypothesis testing studies. So some examples like exposure to smoking is associated with, say, oral cancer, okay, or say brain cancer, and many cancers for that. The another simple example from day-to-day life, students who participate in a school-based life skill program, say, will have more confidence, they'll be more, their self-esteem is going to be high, their self-efficacy is going to be high, and they're going to be less stressful in their lives. So that's a hypothesis. If you have a life skill program exposure in the schools, the pupils are going to be more confident, they will have good communication skills, they will have less stress. So that's the hypothesis. But Now, when the hypothesis laying out, you need to basically know what outcome variable is going to be. So you need to be very, because sometimes our exposures and outcomes are going to be very, very different, and they have an interchanging so you should be very clear what your exposure and outcome is, what is it, and you need to define those variables. Now, there are some kinds of hypotheses, and I would like to spend some time in understanding the kinds of hypotheses. One hypothesis is referred as simple hypothesis. There's another kind of hypothesis which is called as complex hypothesis. Now, the simple hypothesis is that only one predictor and one outcome variable. Have more than one predictor, or it could have more than one outcome variable. Say, for example, sedentary lifestyle increases the risk of kidney disease amongst diabetic patients. So here, our outcome variable is one, which is the kidney disease. Our predictor variable is one, which is sedentary lifestyle. Whereas the lower part, the examples are the sedentary lifestyle and alcohol use increases risk of kidney disease. So our outcome is one, but our exposure or predictor variables are two. Similarly, in the next example, alcohol use amongst diabetics increases the risk of kidney and nerve damage. Now here, our outcome variables are two, like kidney and nerve damage, whereas alcohol use, the single exposure. Now, sometimes we have vague hypotheses, but what is very important is that we should have a very, very clear, specific hypothesis, and one should not have a vague hypothesis. What is very, very important to understand is that the alternate hypothesis. And many of the statisticians and the colleagues working in the statistics department, ask, what's your null hypothesis? Many of the statistical computation is going to be, related to your null hypothesis and your alternate hypothesis. Now, what is very important to understand here is, and this is very important in an analytic study, and suppose I have two drugs, and I'm comparing the drugs, which is superior, which is inferior, or drug A leads to a better effect as comparison to a drug B. Now, my null hypothesis is that there is no relationship. So their effects are equal. There is no difference in the effect. Whereas the alternate hypothesis is my working hypothesis. I'm interested to find out that there is a difference between the two interventions, and the outcomes are going to be different based on what their exposure is. So I assume there is no relationship. I'm interested to prove there is a relation. So I reject the null hypothesis at the end, and that is what I'm interested in. Okay. So my null hypothesis is there is an association between the predictor and the outcome variable. My working hypothesis is the alternate hypothesis. I'm interested to basically prove this relationship. I want to reject the null hypothesis at the end of my study. Now, sometimes is one-sided or two. Now, this is related to the directionality of the effect. Sometimes you know the directionality, sometimes you don't. One-sided hypothesis is that, say, for example, it pre-specifies the direction. So drug A is going to have a better effect. So the directionality is that the effect is going to be more. There is a superior effect, and I'm interested to demonstrate the superior effect. So, for example, drinking well water is associated with stomach problems are going to be more. So it's one-sided. I'm interested to know the one-sided effect. The two-sided hypothesis doesn't pre-specify. So that is two-sided hypothesis. Sometimes the sample size computation, the analysis basically is dependent upon the assumptions which are made in one-sided and two-sided. There are some differences in the computations. Now, just to illustrate the concept of hypothesis, now this is a cohort study which is being laid down, and we get 2x2 tables there. So we have, say, orthodontic therapy, no orthodontic therapy. There are people who are exposed to the therapy. There are people who are not exposed to the therapy. And we are interested to know how much is the degree of periodontal bone loss. So the hypothesis could be, that the degree of periodontal bone loss is more or say it could be less, in people who are exposed to orthodontic therapy as compared to people who are not exposed to the orthodontic therapy. Now, another RCT hypothesis, enhancing motivation through educational videos administered through nurses after orthodontic therapy improves outcomes in patients compared to those who receive usual treatment within the orthodontic clinics. So RCT-based hypothesis. So I'm saying that it's going to improve. So the outcomes are better. So this is one-sided hypothesis, and this is typically there. So some people are going to be exposed to the motivational intervention administered by nurses. Some people are not going to be exposed to that particular intervention, and then you see for a particular outcome, maybe quality of life. Now, once that you have a research question, and if the research question has the hypothesis, the next thing that you do is you basically write the objective. Now, the objective is an active statement. How study is going to answer the specific research question. So, say the earlier PICOT examples that I gave, let's see what could be the objectives there. So, to compare the effect of Ayurveda products, and usual diet taken for 3 months in protecting against COVID-19 amongst older subjects. The substance use example, to determine the role of substance use as a risk factor for suicide amongst young people. So you need to lay out objectives, what your objectives of research is, and that's the next part. Often people who look for the merit in your narration will look for whether these objectives are SMART or not. So SMART stands for S is specific. So they are specific to understand, they are simple, sharp, they will seek new knowledge, they are measurable. You will be able to, at the end, measure variables, and you will say what your exposure and outcome variables are, and they are measurable. You know how to measure, what tools you are going to apply. They are achievable, they are realistic, they can be achieved within the time frame. Then they are relevant, they are going to contribute to the existing knowledge. And of course, we look for time bound, because each research process is contingent to what time. We can't have a very, very long period of time to answer. So questions have a time to answer. So whether the objectives will take that much time and can be answered within the time. So that is what SMART objectives stand for. So to just sum up what has gone so far, I want to first think about what topic interests me, what specific topic interests me. I would like to list few possible questions pertaining to the topic of my interest. You will have to do a lot of background research. You will have to discuss with your peers, mentors, ask what, who, when, where, how. Choose one question and do some rationalization why you want to answer that particular question. Make your question as clear, as specific. Make it pass through the PICOT framework. Make it pass through finer framework, and write SMART objectives. List out the hypothesis, and the hypothesis essentially, sometimes we have to add more specificity to the hypothesis because that is related to your methods. So the initial research journey, you will have to do systematic review. You will have to take inputs from your experts, colleagues, mentors. You have PICOT and finer criteria. Develop a clear research hypothesis, clear and SMART objectives. Now, all of this has implications on your methods, and the methods essentially is going to comprise upon the study designs, the sample size calculations, statistical testing. We did learn about the study designs. Now, I would also spend the last part of my talk. I would like to spend some time, linking these study designs. We learned now a variety of study designs that are available. How can we link with the question and the hypothesis, and looking at, what kind of questions basically suit what kind of study design briefly. Now, on this slide, in one of the journal, one of the article was being published and basically reviewed what kind of research study designs are there, and it basically analyzed about 63 pieces of research studies. And what it found was that a large body was descriptive study. And these are, say, expert opinions, case report, case series, cross-sectional study. Now, these largely are hypothesis generating study, and less are hypothesis testing. But in current times, many of the researchers are interested in hypothesis testing and also improving the intervention-related scientific knowledge. So, in more times to come, RCTs and scientifically done good, RCTs are increasing, but a lot of still, the research is descriptive. As Dr. Krishna mentioned in her talk, that, the right question should be asked, and right answer should be aimed at. Essentially, all of these research designs have plus and minus. It essentially depends on your research question as what you are trying to answer for. Now, what could be the research question for a descriptive study? And the first question is classically for a cross-sectional study. So in a population of study, setting, in a study setting, what is the prevalence of an outcome variable? Maybe say prevalence of periodontal disease in a community. Whereas the analytic study, as I mentioned, analytic study will always have a comparison group. My research question is, in a population, is predictor variable associated with an outcome variable? So I'm interested to know more about the cause and effect relationship. I'm interested to know whether the exposures are going to be risk factors or not. How do they change the occurrence of disease? In the setting of an intervention research, I'm interested to know the effect of the intervention. So in a cross-sectional study, suppose it's done in the field of orthodontics, I want to know what's the prevalence, how much is the total burden, how many people have at one point of time, the periodontal disease. I may collect some information about, their exposures, and I want to know what all associated factors are there. It could be some oral hygiene habits. You also will have to think about, these research questions will then probably make you think, is that going to be a really just an interview-based study, or is that going to ask for an examination? So your tools are going to be decided. Now, often some researchers or some experts will ask you, what's your primary question and what your secondary questions are. Now, if any research study has more than one question, you will have to basically, it's always good to segregate them, some as primary questions and some as secondary questions. Similarly, some hypotheses can be multiple. There'll be some hypothesis, you have to choose one hypothesis as primary hypothesis, and some hypothesis could be then labeled as secondary. Now, why it is important to segregate and to say, something is primary, something is secondary, because researchers or people or experts, is that what is the most important question you are trying to answer for. So you're trying all your statistics, whether it is sample size computation or it is your analysis, essentially have to revolve around so your power analysis, your sample size analysis is based on your primary question. Whereas some research questions are just, additional questions. So you may not have you might not have done, a sufficient sample size calculation for answering that question. Always think about, what's your primary question. So for example, a cross-sectional study, finding a prevalence of periodontal disease could be a primary question, but you wanted more information to be collected because you were, so what are the predictors associated with the periodontal disease? You also collected information about health-seeking behavior, then, that becomes also a secondary question. Similarly, in a case control study, you have, say, for example, the temporomandibular joint pain, TMJ pain. You wanted to basically have cases, and you wanted to collect some association with, say, previous history of trauma or the orthodontic therapy. You can basically lay down what your primary questions are, the risk factors, and if suppose there are multiple risk factors, which risk factor are you more interested in? I will skip this because of the paucity of time, but I think in times to come, this is going to be discussed as what are the measures of association that we do in the analytic studies. Now, this slide basically tells you about the variety of research questions, and in fact sums up what kind of research questions are there. What is the prevalence of the condition? I did illustrate this, that many of the cross-sectional studies is going to answer this question. Your longitudinal studies are going to answer what is the incidence of an outcome. So how many new cases occur in a particular setting in a particular period of time. Then your analytic studies are very, very interested in to know predictors. What are the predictors? What are the risk factors? So you will have to do some measures of association, and you will have to determine. So some case control studies, cohort studies, essentially look on to answer these questions. What are the risk factors and what are the predictors? Your RCTs, your intervention studies are interested in evaluating a particular intervention and the effect of an intervention compared to, say, usual practice or a placebo. So that's a question for finding out the effect of a particular intervention compared to some exposure for a particular outcome. Now, we have two more research questions, and some of the studies will answer that. One is that you want to find out the agreement between the parameters. Say, for example, you have two researchers try to assess something in one individual. Now, there could be a difference, or there could be an agreement to the finding. Say CT films looked by radiologists. So there could be differences in the interpretations. So that is called as an agreement research. There could be two tools, two different tools to diagnose a particular disease, and you want to see by two different methods, how they are going to agree with their finding and they concur with the result. And that also leads to another kind of question. Sometimes we do validation studies. So when we are talking about two different tools, we are trying to find out the predictive abilities of a particular test against the gold standard. So in scientific research, apart from these epidemiological study designs, we also have scientific validation studies and the agreement studies. There the question is slightly different. So lastly, these are the range of questions which the research studies will have. Now, just to sum up the study designs and the research question, now if the investigator is observing the events without altering them, it's basically an observational study. If you are altering the events, you are having some exposures which are being changed, artificially created, this becomes the experimental study. Investigator does not have the hypothesis. So there is no hypothesis. Largely descriptive studies will not have hypothesis. If you have hypothesis in mind and you start with that, so we have analytical studies. If the subject is examined at one point of time, we have cross-sectional studies, so snapshots. Now, when we make measurements multiple times, these are going to be the longitudinal studies, and we have basically the cohort studies. Within the interventional studies, we have some as quasi-experimental studies and some has the true experimental studies. Now, this depends upon, the interventions being, done by following the rules of randomization. And this, I think, I believe it's going to be taken up at a later stage. You have a full session on a clinical trial and an RCT. Randomization is one of the hallmark feature of an RCT. So if there are random allocations being done, who gets the intervention and who doesn't get the intervention, and there's some statistical procedure, some rule that is being followed up in order to decrease and minimize the occurrence of biases. We call those studies as randomized clinical trials, and largely they are superior as against those where these random procedures are not being followed. So they're called as quasi-experimental studies. Sometimes the interventions are done on an individual. They're called as individually randomized clinical trials. Sometimes the interventions are done in clusters. So for example, school, you're exposing all school children to one kind of toothpaste or an educational intervention. Now here the schools act as clusters, and the allocation happens at the level of school. Some schools won't have. We call this as cluster randomized trial. So essentially, whenever you have to think about the questions, you will have to think about the exposures. You will have to think about what your outcome variables are. You'll have to think about when are they going to be measured. Are they going to be measured at one time? They are going to be measured at different times. From how you are going to start the study, are you altering the exposures? Is this intervention research, or is it just a comparison research of exposures and you're trying to find out risk factors? Your questions are going to be what are predictors, which one are going to give us incidence, largely the cohort studies. So I'll just end by saying that whenever you are trying to find out a research question, try to think about what is already known in the literature, do a thorough research, what is your topic of interest, narrow down your question, talk to your colleagues, mentors, trainers. It takes a lot of considerable time in finding out a good research question, make it pass through the PICOT framework, the FINER framework, lay down smart objectives. The methods or study designs are ultimately going to flow from your questions, what you are going to answer. And as I illustrated, there are a variety of questions. I mean, there are questions that will answer prevalence of diseases. There are some that are going to answer incidents related to the disease. Some are going to find risk factors and predictors of the research, predictors of the outcome. There are questions related to intervention research, drug A better than drug B. And then we have, agreement studies and the validation studies. So I think I'll conclude by saying that it's a very critical investment that one researcher has to pay in finding out a good research question, penning down good research question. And believe me, a lot of hard work basically is required in that, and almost 50 to 70% of time is spent on writing a good research question. Once this is done nicely, everything flows from it when we shape our protocols. Thank you. So if there are any questions, if the audience wants me to take, I can address, and if the time permits that.
Professor Sri Devi, ma'am, please proceed. If a question in the chat box, please, you will like to ask to Dr. Malhotra, sir.
Sorry, can you speak up, please?
Yes, I'm just requesting you to take the question for Malhotra.
Oh, okay. To convey the questions to Professor Malhotra.
Yes.
There's a question from Dr. Rajesh. No, before that, there's a question from Dr. Dinesh Baga. What is the difference between experimental and quasi-experimental design?
Okay.
Was that maybe for the previous speaker, I think?
Okay, I'll answer that question. So the the experimental studies, are true experimental studies or quasi-experimental studies. One of the critical step in the experimental studies is having randomization. Now, in an experimental study, if you have two groups, one group receives a particular kind of an intervention, the other group receives the other kind of an intervention. Now, how that is being decided, the allocation is that who receives what kind of an intervention, or a patient is there, a subject is there that falls in which arm. So, so randomization is a statistical procedure which is basically, considered while we allocate subjects to go in either of those two arms. Now, the trials that have this step of randomization are true experimental studies. The trials in which this step of true randomization, or wherein the random allocation of subjects is not being done, are referred as quasi-experimental studies. So there will be some purposive sampling. People are basically, allocated to groups of intervention versus no intervention without the random procedures followed.
All right. There's a question from Dr. Rajesh. He's asking whether the last slides regarding type of studies be shown again. I think we'll do that at the last if there is time. There's a question from Dr. Hani to everybody. Can a research question be changed halfway through the research?
Well, normally this is sometimes, there are challenges, and if you realize that, you are not going to, be able to answer that particular question, then, you come to a kind of a conclusion that I'm not answering the right question. So one should not land up, usually in this situation, that before you decide, when you are deciding for a research question, it requires an ethics approval. So everything basically has to, be approved if you decide that the change of question is there. So what circumstances make you decide that? So, it basically is considered a bad homework being undertaken if a researcher decides that my research question needs to be changed now. So a thorough homework should be done, because once you already take the approval, the regulatory requirements, suppose your funding is there and now you say that you cannot do this research question, it actually also reflects on the credibility of the researcher and the investigator. So normally it is not done, but in circumstances which are exceptional, and if you realize you're not going to get the answers and it's not worth investing, then you basically have no choices. But then whenever the research processes are changed, research questions are changed, it has to begin with all journey again, and it has to undergo the ethics test and the scrutiny of other regulations which your institute might have.
There are a couple of questions on systematic reviews, which I'll come to a little later. I think that might be more appropriate after we've had the session on systematic reviews. But there's one question from Dr. Ankur Agarwal. Sir, can you please explain the difference between null and alternate hypothesis?
Okay. Now, suppose in an interventional trial, I have two drugs, drug A and drug B. And I want to show, I'm interested to show, that there is a difference in the effect or the outcome when the two drugs are administered. Say, for example, for high blood pressure, I have two drugs, drug A and drug B, and I say that the blood pressure control, is going to be better with the new drug, which is drug A, as compared to the usual drug being prescribed, drug B. So my interest is to demonstrate the superiority of the drug A over drug B. So what I want to basically demonstrate, that becomes my working hypothesis, which is also called as the alternate hypothesis. The alternate hypothesis says that there is a difference in the blood pressure control between these two drugs. Whereas on the contrary, I am assuming, in the null hypothesis, that there is no difference in the two drugs, right? So my null is that there is no change in the effect. No change in the effect means there will be no change in the blood pressure after any of the two drugs are being administered to the patients. Well, I'm not interested to basically demonstrate that there is no effect, there's no difference in the two drugs, then why there is a need for trial. So my interest is working hypothesis, alternate hypothesis, in which there is a difference. So statistically at the end, I'm interested to reject the null hypothesis. Rejection of null hypothesis means that, null hypothesis means that there is no difference in the two drugs, the effect of the two drugs. You are rejecting it. You are rejecting means that there is a difference in the two drugs. So does that convey the difference between the null and the alternate hypothesis?
Yeah, I hope it does. There is a question which might be more appropriate on day 3, because we have a lecture on sampling method and sampling size calculation. However, the question is, why do different study designs need different sample sizes? Would you like to take that, Dr.
I'll briefly touch upon, though as the subject is going to be taken up at a later stage, we'll understand the nuances related to it. But I just would like to say that, each research design has some, for sample size computation, you require some assumptions in variables. So those variables are different. So therefore, your sample size computation for different designs are different. Say, for example, in a simple cross-sectional study, I just want, an assumption how much is the existing prevalence of a study. And of course, I will like to assume how much is the error which is going to be there in my study, which is assumed for a particular prevalence estimate. I need all that, and I can get the sample size computation. Whereas when I take case control studies or a cohort studies, when I'm interested in a risk factor demonstrating the difference in the outcome, I would like to assume what is the measure of association. So that variable comes in, and therefore the approach is different. When I have an intervention research or an experimental research, I am interested more to say what is the assumed effect size. Say how much is the blood pressure control I am assuming with a particular drug over and above the usual drug, and what power, what level of significance. So my variables are different depending upon the question and the kind of study design I'm going to use. And all that basically determines the sample size.
All right, so there are two questions on systematic reviews. I would just read it out to you, but if you want to defer it to the last day where we have a topic on systematic reviews, that's okay too. How do we do a systematic review of a particular topic which already has a systematic review? This question is from Subhash P. And then there is another question from Dr. Naveen, who asks, what's the difference between a systematic review and a meta-analysis?
Okay. So I'll answer these two questions, but I hope that a better clarity will be there if you understand the entire things. Now, if there is already a systematic review available on a particular topic, now you need to particularly see that, till what date the research articles are being, included. Now, there might be that a body of evidence is added after the systematic review is published, because there is always a time which takes a publication to be appearing, to the public, and there is good amount of time. So systematic reviews can be updated, and you can say that, if there was a systematic review which was occurring earlier, this is an update of the existing. If there are new evidences emanating from different settings, and they also add up to the body of evidence, so you can actually do an update of existing systematic reviews, and these updates happen, regularly. And because new evidence always keep generating from multiple settings, and there may be that there are challenging evidences, there are contrary evidences to the known, and that can also decide the result. So you can actually do an update of the earlier existing systematic review.
Thank you.
The second question in the systematic review.
Yeah, please continue. Sorry.
Shall I go ahead? Yeah.
Please go ahead. Please go ahead.
So the second question is about systematic review and meta-analysis. So meta-analysis is actually a part of systematic review. Not all systematic reviews will end up in doing meta-analysis, but to reach to a stage of meta-analysis, you have to follow a process of systematic review. Now, meta-analysis is basically done when the evidence coming from different studies that have been included in your review can be actually, pooled up together. So they can be quantitatively combined by a statistical technique. Then you basically, do a meta-analysis and basically come to a pooled estimate. Sometimes there is so much heterogeneity in the evidence which is coming up from the studies available in your systematic review that you cannot combine, or it doesn't make sense to combine them statistically. So then you don't do meta-analysis. Meta-analysis is only attempted when you say that yes, statistical heterogeneity will not be that much, and therefore you can combine and then you can pull up the results. So meta-analysis is a part of systematic reviews. It has to follow through all the processes and the steps that are included in the systematic review. Not all systematic review will end up in meta-analysis. This will actually be contingent upon the kinds of studies and the evidences that you are having, and the degree of homogeneity or the heterogeneity that your studies are going to have.
Thank you, Dr. Sumit Malhotra. There's one last question which you might want to answer. What should a study be named which has both in vivo and in vitro parts?
Okay, now if a study has both, and if you have both components as an important components, a title can reflect both. It's not necessary that you have to choose one. There are many studies and the titles reflect upon the both components. I leave this to the researcher and decide. But if they're both the components are equally important, I would like to reflect upon both the components.
Thank you, Professor. There is one more question which I'm not going to ask you for an answer. The question is, if research is finding the truth, then why don't we accept the truth? Why is there manipulation? I think we have two experts who are going to speak on bioethics, Dr. Nalin Mehta and Dr. Rajiv Aluwalia on later dates. We'll defer that question to them for a clarification later on. And then there is one more question about how to build up a research topic systematically. We will again leave that to Dr. Priyanka, who's going to speak on systematic reviews. We will leave a little bit for people to expect and anticipate. Thank you so much, Dr. Sumit Malhotra.
Welcome.
I think that brings us to the end of the session. Over to Dr. Ritu, please.
Thank you, ma'am, for taking this question to our speaker, Dr. Sumit Malhotra, sir. At this moment, on behalf of Indian Orthodontic Society and Division of Orthodontics, I would like to thanks to Dr. Sumit Malhotra, sir, for such a wonderful session and very informative session on professional research question and hypothesis, and our previous speaker, Dr. Krishna Bhatt, on the topic of the study design and research. Now we have posted some the feedback questionnaire and link it in the chat box, and I request to all the delegates to fill this feedback questionnaire so that we can answer if you have any question which have not answered here, so that we can answer in the panel discussion session, number one. And number two, it will help us to send the certificate to all the delegates. At this moment, I would like to thanks to all of you for participation in this webinar session. Thank you so much.
Thank you, and I would like to just add that tomorrow again we'll meet at 12 o'clock. 12 o'clock the lecture is Performing Literature Research and Literature Review by Dr. Ashok Jaryal, and then followed by lecture at 1 o'clock, Working with Reference Manager Software by Mr. Yogesh Kumar. We look forward to meeting you all tomorrow at 12 o'clock. Thank you so much. Have a nice day.
Thank you.